Next, on Currents News, vaccinating kids with Pfizer approved for children as young as 12. Should you roll your kids' sleeves up? We have what parents need to know. Plus, lawmakers call for a vote on babies born alive during abortions. A member of the USCCB's pro-life committee is here to talk about the Born Alive Abortion Survivors Protection Act. The Diocese of Brooklyn has a new youth minister to teach the next generation of Catholics. And an accident puts a 13-year-old girl in a wheelchair. Her family now putting their faith in God for her to walk again.
We're not in denial, but we're waiting for science to catch up to faith.
The FDA has cleared Pfizer's COVID vaccine for kids between 12 and 15 for emergency use, making it the first available for anyone under 16. Good evening, I'm Christine Persichetti. The question now is, will parents sign their kids up? While many adults have rolled their own sleeves up for the shot, they're hesitant to do the same for their children. But doctors say they shouldn't be.
Ready? 1, 2, 3, stick.
More and more kids are now able to get the COVID-19 vaccine, and some, like 14-year-old Jacob Laney, are already lining up.
Well, I'm going to be able to go more places without being scared of getting COVID-19, and I'll be able to just feel safer anywhere.
But some parents aren't convinced the vaccine is safe for their kids.
I want to learn a little more about it before that happens, just to see if there's any adverse effects.
So far, doctors say they've only seen slight reactions after Pfizer's trials of about 2,000 kids between the ages of 12 to 15. And Dr. Robert Tebow of the Catholic Medical Association says it is safe for children.
Bottom line is I think the children should be vaccinated, yes.
And researchers actually found after getting the second dose, 12 to 15-year-olds had even higher levels of antibodies than 16 to 25-year-olds who had also gotten the shots, making them far less likely to get sick.
18 cases of COVID in the 1,500 adolescents that had placebo and 0 in the group that got vaccine.
Some might argue COVID in children doesn't tend to be that severe. In fact, according to the CDC, children under 18 make up about 12% of all cases, but also represent just 0.1% of all COVID-19 deaths. So why get the shot? Here's one good reason.
We worry very significantly that there could be a mutation in the virus where it could actually, seriously affect children, and that could happen anytime.
So the focus now is going even younger. Trials have begun in children like 7-year-old Naomi, who has a message for those unsure about getting vaccinated.
That would be a great way to keep the world safe.
Dr. Tebow says while the vaccine for kids is the same material used for adults, it is a different dose. Meanwhile, Mayor Bill de Blasio says public school students will not have to be vaccinated to return to class in the fall. Americans are questioning mask mandates with COVID-19 numbers falling nationwide. The number of people wearing masks whenever they leave the house is down to 58%, the lowest point since last June. Now, a review from the New York Times found no documented COVID infection anywhere in the world from casual outdoor interactions. Lawmakers are calling on the CDC to rethink mask mandates and other guidelines.
The conflicting, confusing guidance from your agency has undermined public confidence.
At this point, about half of all Americans have received at least one vaccine dose. The Vatican is continuing its month-long prayer marathon, hoping to bring an end to this pandemic.
Je vous salue, Marie, pleine de grâce.
Tuesday's service was in Belgium at the Shrine of the Virgin of the Poor. The rosary prayed there was dedicated to the poor and homeless. Next Monday, the marathon will come to the United States at the Basilica of the National Shrine of the Immaculate Conception in Washington, D.C. Net TV will be airing that prayer of the rosary live. That'll be on May 17th at noon. The Diocese of Brooklyn has a new director of youth ministry, and his first mission will be to help prepare for World Youth Day. Currents News' Emily Druby spoke with Father Emil, who comes to Brooklyn from Poland.
World Youth Day, where Catholics from around the world deepen their faith together. A beautiful and vibrant event, the next international one is set for Lisbon, Portugal in 2023. In the Diocese of Brooklyn, preparations are underway with the help of a new face. Father Emil Parafinuk is the new director of youth and young adult formation. He's worked with World Youth Day for years at all different levels.
And the parish level, after that diocesan, and after that national level.
He hit the ground running after starting in April.
We are starting our preparation process because World Youth Days are not just an event, just a trip. They are a pilgrimage, and we should be very well prepared.
Focusing now on preparing spiritually.
I'm going to invite all parishes to have some spiritual preparation on the 23rd day of the month.
Father Emil is also preparing to hold 5 in-person events for the local version of World Youth Day if it's safe. The date for those moved to the Solemnity of Christ the King in November by Pope Francis. So many other steps go into planning World Youth Day, coordinating with youth ministries, working with travel agents. Father Emil is working with Father Gerard Sauer, the Diocesan Director of Pilgrimages.
This would be World Youth Day in Sydney, Australia.
2023 will be Father Sauer's 10th World Youth Day. 10 trips, 10 chances to change lives.
They come back a changed person, and for a young person, to say, you know what, I thought I was the only young person in church last week. No, there's 2 million, 3 million other teenagers that are going to church just like I am. So it really unites them in faith as well.
The last World Youth Day brought out over 500 young people from the Diocese of Brooklyn.
This time of pandemics helped us to understand that we need us together, that we want to meet, that we want to travel together, that we want to do a pilgrimage together.
Father Emil is hopeful the numbers will also be strong for 2023. In Windsor Terrace, Brooklyn, Emily Druby, Currents News.
The FBI is investigating the cybersecurity breach which temporarily halted fuel lines from Texas all the way up to New Jersey. Authorities are blaming the Colonial pipeline attack on a hacking group known as DarkSide, a Russian criminal enterprise that claims to be apolitical. But the FBI and other U.S. agencies are investigating whether the Kremlin is behind the attack. President Biden is set to hold his first summit with Russian leaders next month. The pipeline company says it hopes to restore service by the end of the week, but lines are growing at gas stations in North Carolina. However, drivers are already scrambling for gas as concerns over shortages increase from Virginia to Florida. Industry professionals say hoarding gasoline could squeeze supply in the short term and cause a sharp rise in prices. Lawmakers say the country has become too reliant on gasoline.
We keep getting these wake-up calls, and we're not waking up. I said to somebody the other day, we're looking at the longest wind-up for a punch in the history of the world. And we got one over the weekend, and we learned how vulnerable this pipeline system is.
The pipeline attack is also prompting the White House to address vulnerabilities in the country's cybersecurity. As we wait on the White House to comment more on the hack, some lawmakers on Capitol Hill are pushing for a vote to protect infant survivors of abortion. Here to tell us more about the Born Alive Abortion Survivors Protection Act is Kat Talalis, Assistant Director for Pro-Life Communications for the USCCB's Pro-Life Committee. So Kat, first tell us what this bill would require.
The Born Alive Abortion Survivors Protection Act makes the obligation of abortion providers clear, and that is to provide newborn survivors of abortion with the same care and attention that will be provided to any other child at the same gestational age. It also requires these abortion providers to give the child to a hospital where they can receive care from qualified specialists, and makes the abortion providers and all clinicians and staff at these clinics mandatory reporters in case that law is not followed.
So what kind of care are babies currently being given if they're born alive during an abortion?
Unfortunately, it's really hard to know because the reporting very much varies state to state, but the outcome probably isn't very good. Again, abortion providers are hired to terminate a pregnancy and to ensure a live birth does not happen. So we know, and we know from examples over the past several years, that a lot of abortion providers have not been providing the standard of care as is listed in this act, which is again just to give these newborn babies care and a chance to survive.
Virginia's Governor Ralph Northam, who's a pediatric neurosurgeon, answered that question himself during an interview in 2019. Let's take a listen.
If a mother is in labor, I can tell you exactly what would happen. The infant would be delivered. The infant would be kept comfortable. The infant would be resuscitated if that's what the mother and the family desired. And then a discussion would ensue between the physicians and the mothers.
So how often does this actually happen in the U.S.?
Unfortunately, because of the gaps in national and state abortion reporting and the continued opposition from abortion advocacy groups to improve reporting, there's a lot we don't know. But we do know that even in states that do require some level of reporting, any reporting on how these babies survive after abortion is done by abortion clinic staff, again, who are hired to terminate the pregnancy.
Right.
Based on the limited data that is available, we believe it's probably hundreds of children each year, and that's a conservative estimate.
So let's take a look at some of the numbers we do have. Between 2003 and 2014, the CDC analyzed death certificates and found that at least 143 babies were born alive and subsequently died after an attempted abortion. In 2017, Arizona reported 10 babies born alive in just a 5-month period. Now, as you know, only 29 states publicize data on abortions each year, and a lot of it is very outdated. Why do you think that is, and do you think all of the data should be made available to the public?
Absolutely. This data should be made available. And one thing that this bill does, again, is hopefully improve reporting by making these clinician staff mandatory reporters. We do know that the more information we know, the better. And I sincerely hope that, again, that all this information will be brought to light, because the public does deserve to know about these babies who are born alive during an abortion.
Absolutely. So talk about the status of the bill now. How many congressmen have signed on so far? How many signatures are still needed?
Great. So the discharge petition is actually in a really great spot. It was just launched a few weeks ago, but already 209 congressmen have signed the discharge petition. And that is only 9 congressmen away from the limit needed to bring this bill to the floor.
So what can people at home do to try to make sure that this bill is passed?
One of the most important things they can do is to advocate, to contact Congress. And we at the USCCB have an action alerts page where people can go to usccb.org and take action and contact their congressman directly and ask them to sign the discharge petition.
All right, some good advice. Kat Talalis, Assistant Director for Pro-Life Communications for the USCCB's Pro-Life Committee. Thanks for being here today.
Thanks so much for having me.
As Kat said, if you would like to encourage your local congressman to sign the Born Alive Act, go to usccb.org/take-action. The U.S. bishops also fighting a Democrat-led repeal of the Hyde Amendment, named after Republican Congressman Henry Hyde. It was a law enacted in 1976 in response to the Supreme Court's Roe v. Wade decision. It bars taxpayer money from being used for most abortions and is re-upped every year as a rider to federal spending bills. President Biden has said in the past that he will work to overturn the law. A repeal of the amendment would require both chambers of Congress. The House and the Senate are now in Democrats' control. There's a lot more news headed your way. A 13-year-old girl believes she will walk again after an accident. How she stays positive in spite of her challenges. Plus, a new degree at Pontifical University is looking to improve relations between Jews and Christians. And the COVID-19 crisis in India is only getting worse, with small villages hit the hardest.
It's so motivating. I have never been so moved by a patient here at Blythedale as I am with this young girl.
A 13-year-old girl is inspiring others after a skiing accident put her in a wheelchair. Now Olivia and her family are putting their faith in God, praying that she'll be able to walk again. But even in this dark time, she has not once given up and accepts each day as a new challenge. Currents News' Jessica Easthope spoke with Olivia and her parents and has more.
Olivia Benedetto is a self-taught gymnast.
I could do an aerial, a front aerial, back walkovers, front walkover, like you name it.
It's funny how now
her parents, Nick and Colleen, say they're amazed by how she can flip and twist.
We have a little yard, and she'd go out there every day and teach herself something new. Every day, teach herself how to do this, and we put up a trampoline for her.
But recently, Olivia's world was turned upside down. On February 16th, Olivia was in a horrific skiing accident in Pennsylvania. Her dad and older sister witnessed the moment that changed her life.
She went up, and all I see was go back, and just landed on her back.
I remember like my lower back being in so much pain. My legs felt a little weird, so I started to move them, and I still could, which I was like grateful for.
Olivia suffered a spinal cord injury and had surgery, but hasn't been able to move her legs since.
24, that's the day.
For the last few months, she's been living at Blythedale Children's Hospital in Valhalla, her parents commuting back and forth every day from Breezy Point. Olivia's handling her injury with grace beyond her years.
For my surprise, I'm getting...
The other children at the hospital are drawn to her.
If I was there to sit in
Even her doctors are in awe of her outlook.
To see her accept this, hope for the best, but try to become as independent, as strong as she can, it's so motivating. I have never been so moved by a patient here at Blythedale as I am with this young girl.
Her faith in God and herself is what's keeping her strong.
I feel like God is always with me, and I pray every night, because negativity, you're never going to live your life to the fullest, but with positivity, there's always going to be something great out there.
The doctors caring for Olivia have told her she might not recover much more, but the family, who belongs to Blessed Trinity Parish, are clinging to a glimmer of hope.
We refuse to accept that. We're not in denial, but we're waiting for science to catch up to faith.
Because of her accident, Olivia missed her confirmation. But her mom, Colleen, is hoping a special saint will intercede for her.
Start thinking about names for confirmation. She came across this name, and it was St. Gemma. And then a month later, the accident. And that night, I looked up who the patron saint of spinal cord injuries were, and it was St. Gemma.
How do you do that? Up until her accident, Olivia was practicing her backflip. She was constantly filming herself and critiquing her technique.
Oh, she did it!
She and her family are praying for a miracle.
Oh, I found a few more.
Olivia loves watching her gymnastics videos.
No hands. Yeah, this one was like one of my favorites.
Hoping she'll be at those backflips again.
Oh, I did it! Okay.
In Valhalla, Jessica Easthope, Currents News.
What a brave girl. Pontifical Gregorian University in Rome has developed a special degree in Judaic studies and Jewish-Christian relations.
In the Catholic Church, we often say that Judaism are our roots. But when we say roots, our idea is that roots are in the past. The roots of our tree are not in the past. The roots of a tree are now.
The two-year program brings students from around the world to Rome in order to exchange ideas and strengthen the bonds of faith. The U.S. is defending Israel after airstrikes in Gaza, saying the nation has a right to defend itself. At least 30 people are reported dead in a second day of rocket attacks from Gaza and the Israeli airstrikes. Israeli Defense Forces say they killed 3 Islamic Jihad militants in Gaza and claim about a dozen other militants have died in these strikes. Palestinians say 10 children are among those killed in Gaza. A United Nations panel has clear and convincing evidence that ISIS committed genocide against Yazidis 7 years ago in northern Iraq. Tens of thousands of villagers from the religious minority fled their homes, trying to find safety on Mount Sinjar. But thousands more didn't even have the chance to escape. For the past 3 years, a UN team has been gathering evidence, witness testimony, cell phone data, and documents to build the case against ISIS. India continues to face a devastating second wave of COVID-19 cases, and it's now spreading fast into rural areas where health centers are few and far between. As Sam Kiley reports, neighbors are burying neighbors as remote villages see a surge in deaths.
It's the injustice of a disease that strikes at random that Govardhan finds hardest to bear. He insists that he hasn't cheated anyone in his life. At 70, no one will speak ill of him. A lifelong potter, every household knows him. For the local pharmacist, Jitu, it's too much. He's done what he can to help, but dozens have died here in the last month. And Govardhan has been ill for 3 weeks. This is Jitu's home. Most in this Gujarati village in India's west are farmers enjoying fertile soil and plentiful livestock. When the wave of India's second pandemic engulfed India's teeming cities, people in the rural areas were not spared. With no village doctor or medics and a shortage of hospital beds in faraway cities, many here rely on Jitu's experience as a pharmacist. He sourced oxygen, prescribed drugs. There's no one here, no health centre, no doctor, no nurse. There are no facilities in this village. So then I tackled it in the way I saw fit. Givraj has seen the devastation of his village, yet his fear is no longer death. It's that COVID will destroy his family. Their home is not far from the village crematorium, which is where volunteer efforts shift from Jitu to Giagashanga. Until today, he's been cremating people almost constantly. Now he clears up their remains. Vessels are ready for families to carry the ashes of their dead. Urns made by Govardhan the potter before he fell ill to a disease which has taken so many of his neighbours.
That was Sam Kiley reporting. On average, the village cremates 30 bodies a year. However, in the past month alone, the village cremated 90 people. Still to come on Currents News, football player Tim Tebow could be returning to the gridiron this year, and a nurse working on the front lines of the pandemic has inspired her 4 sons to join the fight. Tim Tebow might be taking the field again. NFL Network reports the Jacksonville Jaguars plan to sign the former quarterback, but they want him to be a tight end. The player, known for his outspoken Christian faith, hasn't been on an NFL roster since 2015. If he returns with the Jaguars, it will be a reunion for Tebow and coach Urban Meyer. They led the University of Florida to 2 national championships. The Jaguars haven't commented. One nurse in Virginia is setting an example for her children, saying when people need help, it's time to get to work. Michelle Fletcher has been working on the front lines throughout the pandemic and has inspired her 4 sons to change their careers. Now they're working alongside her at a vaccination clinic, helping with registration, coordinating volunteers, and assisting patients.
Just being here and hearing some of the stories from clients that come in who have lost loved ones or friends and family, and seeing how thankful they are, that really opened my eyes to kind of see how important it was to get everybody vaccinated.
The Fletchers say going to work together has made them closer as a family. Their mom even makes them lunch some days. Aren't they lucky? And that is Currents News. I'm Christine Persichetti. Thank you for joining us, because we are putting your faith in the news. Hope to see you again next time.